When I mentioned to a colleague that the school was hosting an event on alcohol use, he immediately responded, "Just tell people not to drink." And oh, if it were just so simple. We know that like other social issues, just saying no is really not enough. And we know, like other social issues, that alcohol use and abuse is very complex. The discussion is informed by science. Alcohol is regulated by the government, and alcohol use and abuse really involves individuals' behavior and also cultural norms. And that's why it is so complex. Public health is a field that understands, I think, that science is needed to make good decisions, that appropriate policy and regulations based on appropriate science can have positive impacts, but that no matter how much science and how much regulation is put in place, it's also necessary to address personal behavior, to really get to the not only the individual but communities and populations, and that's what makes us a little bit different. So in order to have the greatest impact, you put all those three things together, and you also hopefully within those communities you really work with those communities, and that means understanding them so that you can be most productive. And usually that involves individuals from those communities who will be positively working with those communities. So the intent of this event is to present the multiple sides of the issue of alcohol abuse and use, and encourage you to participate in the panel discussion, because there are plenty of different opinions and viewpoints, and we really do want you to express your own individual viewpoints, and you'll have the opportunity to do that. We have two students on the panel today, so I hope they're going to share their understanding of student behavior, if that comes up, and educate those outside that group, which would include me. Although we are lifelong learners, we're not the certain age group anymore, and sometimes we get distance from those groups. But ultimately, we're all working toward the same goal, and that is to minimize the negative impacts of alcohol abuse. And as always, prevention and public health and health sciences and intervention are also key.